anyone who's just considering, who's completely new to low carbohydrate sort of concept, how would you define it? Obviously, it varies from person to person because it's very dependent on each individual's aims, goals, but also health status, right?
Yes.
So how would you introduce someone new to this sort of lifestyle diet? How low is low carbohydrate?
I think if you don't mind, I'd rather start with, well, why should you do it in the first place, in terms of, because I think it's more important before you get on to the details of how you do something, why should you do it? Mm-hmm. And this is what I've learned from my wife, who's a consultant psychologist. And she says it's key that people are interested and fascinated by what benefit might I get before you tell them what to do. So let's do that for the listeners and viewers today. So if we think about the hormone insulin, so insulin is an absolutely key hormone in regulating blood sugar. So when we were designed, why was insulin brought in? And insulin is brought in because you must regulate blood sugar in a small frame of safety. And so a high blood sugar over time is very dangerous. In fact, in even 6 hours, a high blood sugar is beginning to damage the lining of your arteries. And so for people with diabetes, whether it's type 1 or type 2, time with a high blood sugar is damaging your arteries. And that's why you are so right to pursue a careful approach to your blood sugar. Because if you had poorly controlled blood sugar for 40 years, you could be facing heart disease quite easily. And so 2 things become really important. One is time in range, so trying to ensure that your blood sugar is well controlled through the day. And the other is the hemoglobin A1C, which is the blood test we do, which is the average sugariness over 3 months. So we know that if you have poorly controlled diabetes, you are losing 1/3 of your life expectancy due to the damage to the arteries. So it becomes pretty obvious that we all need to work hard to help people have good blood sugar control. For somebody with type 1 diabetes, this becomes, it's important on a day-to-day and hour-to-hour basis, because you need to know how much insulin to use. But in terms of longevity, it's also very important for people with type 2 diabetes because of the damage to the lining of the arteries done by high blood sugar. And so that's one reason that you should be very interested in how much sugar you're eating. Because of course, one of the major things that affects your blood sugar is what you've eaten. Nearly always a high blood sugar, as I'm sure you know, is the high blood sugar is high because of something you ate. Now, it's not always what you've eaten, because steroids can put up blood sugar and stress can. But for most people, a high blood sugar is what you ate. But then we come to some broader aspects. So high blood sugars also affect your immune system. It affects your blood pressure. For some people, it affects their mental health. So it isn't just for diabetes that you might consider a lower carb approach. So that leads us now into, so that's why medically it might be beneficial. You might improve your blood pressure. You might improve your weight. Particularly, you might get rid of a big tummy. You might improve your diabetic control. Or for some people, there's increasing interest in mental health. And people are talking about keto improving anxiety and bipolar disorder. So it's a really exciting area. But now we come to the actual question that you asked. So in research terms, a low carb diet is less than 130 grams of carbohydrate per day. As a clinician, I don't really talk about 130 grams of carbohydrate very often, because my patients don't think in terms of grams. I'm getting them to turn the starchy white foods green, so that you would replace bread, rice, potatoes, maybe with more green veg. You've also got to, of course, eliminate sugar itself. Mm-hmm. And that leads to an emphasis on green leafy veg, more protein and less carbohydrate. And that's what I'm doing for my patients.
Mm-hmm. Interesting that you don't get them to count carbohydrates.
No, or weigh. I don't. I think of family life. I'm not sure that weighing your food and counting fits in well with all of the stress of family life. And you know, the mother is there and dad's there and whoever. And so I'm trying to get an emphasis on healthy whole foods and away from counting, weighing, measuring. And so some of my patients like to do that, and I will help them. But a lot of them just start having more protein, more green veg, cutting out the starchy stuff and the sugary stuff. And for many of them, that's good enough. They lose weight, their blood pressure improves, and their blood is less sugary. So for many of them, I'm not counting stuff. I'm not very enthusiastic about that.
Mm-hmm. That's interesting. That's an interesting perspective. And I can relate to it as a type 1 diabetic, because for, I can't remember how long, for good 22 years, when carbohydrate counting and matching insulin to carbs came about. I remember it was the year 2000 when I lived in Cambridge at the time. I went on the first course of carbohydrate counting, and it was useful to know how many carbs you're eating. But now I know that it wasn't accurate. Now we know it's not accurate because, you know, because it's just, someone said it, I think on my channel, that it's, you know, at best, it's just estimates. So the amount of fiber, and
in any case.
Yeah, and so it's not accurate, and you can never replicate a real working pancreas and match your insulin perfectly, the timing and the dose to the carbs you're eating. Yes. So now I do not count carbohydrates, and I'm in a healthier place because I just don't eat the pasta and the bread and even fruits I don't eat. So I don't need to count carbohydrates. I just take a bolus to cover my meal, and my meal will be protein based, for which I still need some insulin, but that's about it. I just eyeball it and I get it right every single time. That's it. No counting carbohydrates. And it's just such a relief.
It's more relaxing, unless, you know, it's just you want to get on with your life. You're hoping that the diabetes doesn't interfere with your life. And it's ironic now, you could say, well, there's two ways to do this. One is there are people who say, I want to eat whatever I want to eat because they don't want the diabetes to interfere with their lives. That's a very short-termism, because, well, you can do that for a while, but you probably become sick because of all the sugar you consume. And later on, you know, losing your vision, or all of the things that can happen with poor blood sugar control. So there's this idea that I want to be, you know, live a normal life. For me, the normal life is not centered around what I eat, but the normal life is centered around my actual health, my vision, my energy, how I age. I think that's far more key than being allowed to eat ice cream anytime I want, because I think that's just foolish, really. And another thing I meant to say is, I think a lot of people don't realize that there are many foods you can eat that don't put up your blood sugar. So for me, I know that a steak and broccoli, if I'm wearing a Freestyle Libre that's monitoring my blood sugar, there will hardly be any increase in my blood sugar. So you know, there are some delicious foods I can eat that don't put up my blood sugar. And then, you know, it's a pity not to eat Christmas cake, you know, but I've done it now. So I have been myself in nutritional ketosis, low carb. So that's from 2013. So I'm just nearly at 10 years now.
Mm-hmm. And after a while, you don't even miss these things. I mean, I don't even crave pasta and cakes. I mean, of course, there are people who would, but a lot of people also are like me. You get used to not eating them, and then you just lose your taste for them.
I agree. And I think one of the things that happens is your taste buds, if you can keep away from sweetness particularly, your taste buds recalibrate. So that for me, red wine now is a very sweet drink. Milk, even a small amount of milk in tea, tastes very sweet. And so all sorts of foods, my taste buds are far more active, and you may have found something similar than they were before. So I taste food in a very different way. And I appreciate that because in a way, I enjoy my food more, I think, now.
True. Yes, I relate to that too.